Welcome everyone to today's webinar, Ransomware Prevention in Hospitals, 5 Steps to Take Immediately. I'm Katie Adams with Becker's Hospital Review, and on behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'll walk through a few quick housekeeping instructions. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. With that, I am pleased to welcome today's speaker, Chad Holmes. Chad is Scenario's security evangelist and helps educate the healthcare industry on threats introduced by devices and their environments. Prior to Scenario, Chad worked with a variety of technologies ranging from call center software to military logistics systems. Over 20 years of helping create, break, and secure a variety of technologies, one thing has become clear. Hackers are often far less sophisticated than many are led to believe. Unfortunately, the shame and secrecy related to breaches usually prevent sharing of valuable details and lessons that could help entire industries. In an effort to better educate leaders about their adversaries, risks, and approaches, Chad discusses real-life incidents, attacker motives, victim responses, and various other factors. Thank you for being here today. I'll now turn the floor over to you to begin today's presentation.
Great. Thank you very much, Katie, and welcome everyone, and thank you for attending today's talk. So a little bit about me before we jump right into it, so you know who's kind of talking to you. My name is Chad Holmes. Throughout my career, I've had a variety of focus areas. As Katie was saying, I started by making things. I was a software developer, was working on military systems, started breaking them unintentionally, finding really sensitive information rather easily. And as I worked with more and more companies and governments to secure those systems, I found there were a lot of really skilled people that with just a little bit of training and a little bit of guidance could become really good security experts, whether they entirely focused on security or they continued their current roles and brought a better security mindset to it. So whenever I give these talks, I like to try to continue that education mindset, and that's what I hope to do today. My goals today, I have a few different things that we're going to try to hit on. One is talk about the real risks that we're all facing in terms of cyber attacks and ransomware in healthcare organizations. Cover 5 different topics, kind of what can we do topics, specific actions or specific categories of actions we can take to better improve the education and process and technology around ransomware attacks. These will be both operational and technical options. So some will be, hey, you should implement X, Y, and Z. Others should be, you should talk about ransomware in this way for better education. Of course, we'll answer questions, so keep those questions coming throughout the event. I'll try to answer them in real time if I can. If I don't get to them in real time, we'll make sure to hit them at the end. And then I will reference a bunch of studies, articles, et cetera, throughout today's presentation. So I'll provide those additional resources as we go through. If for some reason I don't have a link or you didn't quite catch it during the presentation, let me know and I'll gladly pass along both the deck and the specific articles, studies, et cetera, that I reference. Before we jump right into it, I do have 2 kind of small housekeeping things. If you haven't heard about Scenario, we are a IoT security company. Our goal is pretty simply stated. We want to secure every IoT, OT, and medical device in healthcare environments. We are 100% healthcare focused. 2020 was an incredibly exciting year for us. We were named both a Gartner Cool Vendor and a Forrester Wave Leader. And on the backs of that, we've expanded our footprint across the globe. We recently received a 94.8 out of 100 score based on KLAS customer reviews. So many thanks to our customers that help with that. And hopefully there are more future customers on today's call. The other thing I want to point out is that when we talk about ransomware and cyber attacks in healthcare, very often the focus is on data breaches, right? We don't see a lot of these jumping directly to patient care, although I'll talk about that as we go through. Our team released a set of disclosures last week called JekyllBot 5, which helps paint the picture of what actually can happen when you jump from cyber attacks to cyber physical attacks. In short, we were able to control hospital robots, specifically Aethon tugs, around the globe. So we're trying to educate folks about what those attacks look like and how we can prevent them going forward. So if you want to learn more about that, we do have both a command center available and a webinar later this week that you are more than welcome to attend and learn more about those attacks. So as we go through today, remember, we want to prevent ransomware because it damages hospitals' finances, it has collateral impact on patients. But if we find attackers start to change their focus to actually harming patients, which we hope doesn't happen, there are specific things we can do to prevent that and specific attacks that are available to them, unfortunately. With that in mind, let's actually get to the topic at hand, which is how can we start to better prevent and improve the ransomware situation in healthcare? And the first thing I want to talk about is a better set of habits. And that is when we start talking about ransomware in healthcare, actually talk about ransomware in healthcare. And let me give you an example of what I mean. There's this great article that came out in December of last year. It talks about killware and how killware probably isn't going to happen because ransomware attackers are motivated by finances, things like that. Really, really good article. Liked 95% of it. You can see the link there at the bottom. But the article made a critical error that I see many other articles, talks, webinars, etc. make. When it actually started talking about what the risks were for ransomware in the healthcare industry, they used two very specific examples. The first example they used was Colonial Pipeline, where about a year ago now, a back office system was hacked due to default admin credentials in an old server. So they talked about oil and gas and the risk to oil and gas companies. And then they talked about the avoided breach of a water treatment plant in Florida. And my issue with this is if you're talking to hospital staff, if you're talking to hospital administrators, and you say, hey, ransomware is hitting hospitals hard, people are getting shut down, here's an example of an oil and gas company that did, and here's an example of a water treatment plant that did. There's a massive disconnect there. We can't talk to hospitals about other industries because hospitals don't know the actual risks that are there. This bugs me even more because we actually have a significant amount of data about the overall industry risk and specific risks to individual organizations within healthcare environments. We know that just last year alone, there were about 700 providers impacted in the healthcare space by ransomware attacks. There were 40 million records. By the way, this is US numbers. We have other global numbers if anyone wants them. But there were about 40 million records exposed. Roughly 10% of the United States had their records exposed due to breaches of some sort in healthcare. The overall cost and impact on the healthcare industry was $21 billion. And that's kind of a big nebulous number. So I'll talk about how we get there in a second. And we know that over 20% of these attacks were rooted in IoT devices, kind of the same rate as phishing and a much higher rate than people would expect. But it's not just a financial aspect to these attacks that is becoming more and more dangerous and more well known. These numbers on the right are from a recent Ponemon Institute survey, and I'll link to this a little bit later in the presentation. But what they did was they went around to hospitals in September of last year and asked, during the COVID timeframe, so about an 18-month timeframe at that point, if you were attacked by ransomware or if you suffered a ransomware attack, what were the results to patients? In those that had suffered an attack, 71% of them reported longer lengths of stay, a little over a third saw increased complications, and almost a quarter saw increased mortality rates. So when we're talking about ransomware, it's really easy to focus on the direct impact. The hospital gets shut down, they might have to pay a ransom or pay exorbitant costs to recover. But there is collateral damage that is happening that kind of flies under the radar. Effectively, anytime you have deferred or delayed treatment, you are going to see care go down. That's kind of well known, whether it's from ransomware or for other reasons. Now, these are big overall numbers. If we dive a little bit deeper, we can look at something like Scripps Health. So Scripps Health is a Southern California healthcare chain. It's 4 or 5 hospitals, roughly 20 clinics, give or take. So good medium-sized healthcare system in Southern California. And the reason I like to talk about Scripps Health is because outside of a very specific audience, it doesn't get a lot of attention, even though it had more damage suffered than the Colonial Pipeline attack. So if you look at last year, this time in April 29th, Scripps suffered a ransomware attack. A week later, Colonial suffered a very similar attack. It was ransomware, different technical reasons, but same kind of business case there. It took Scripps about 2 weeks, just under 2 weeks, to actually disclose the attack. They did everything they possibly could to handle it, so I'm not here to shame Scripps in any way. I actually want to thank them for disclosing this information. And within 2 days of that, Colonial was actually back up and running. So when we talk about Colonial, not only is it misfocused on what we should be talking about, but their entire attack lasted about a week. And most of the outcomes were because they decided to shut down. Scripps, on the other hand, was well over a week. And as of August, they were still figuring out the cost and the impact to their hospital system. And the impact was absolutely staggering. They lost $90 million plus in revenue. It cost them over $20 million to recover from the attack. There's currently $600 million in pending litigation. The regulatory fines are just unknown at this point. And at the end of the day, the cybersecurity insurance only paid out about $6 million of the overall $120 million cost. There's also a broader impact that we're starting to see information come out about, where because Scripps had to shut down services, there was the cascading effect of patients going to other hospitals, seeing more crowded waiting rooms, things like that. So it is a cascading impact whenever these attacks hit. And it's not just Scripps that have been attacked. Pretty much anywhere you look, you're going to find some reference to a ransomware attack on hospitals. Right? Skylakes was hit and cost them about $10 million to recover. UHG on the provider side cost them was $70 million. Scripps is over 110. University of Vermont was about $63 million. Now, I want to call out University of Vermont very specifically here, because the leadership that was in charge when that attack happened has taken a very different stance on how they communicate what happened there to help educate the industry. If you take nothing else from this webinar, other than ransomware is really damaging, we need to do something about it, know that University of Vermont have come out, gotten past the shame, gotten past the fear of lawsuits, and said, we need to educate the rest of the industry about how to better protect themselves. And we're going to do that by talking about the attack. So I would highly recommend everyone after this event, Google University of Vermont AHA ransomware podcast. There's a 30-minute session where they talk about the attack, how they handled it internally, what the costs were, what the recovery looked like, et cetera. There's a great insight to what a ransomware attack looks like from an administrator. We also are starting to know, because of the Scripps disclosures, because of the University of Vermont disclosures, what the actual cost components of these attacks are. And they range from lost revenue to ransom paid. Some people pay ransom, others don't. We'll talk about this as we go through. There's the long-term costs of litigation, repeat attacks, and unfortunately, cybersecurity insurance is getting smaller and smaller in terms of payouts and harder to come by. So it's not just one or two hospitals that are getting attacked. It's dozens and hundreds, with costs well into the six figures in many cases to recover from them. And we need to start better protecting against it. And of course, there are kind of tragic stories like Spring Hill Medical, where a ransomware attack is said to have caused the death of a newborn. Luckily, we do not see a lot of cases like this. You know, that one case is tragic. We hope not to see more, but there are direct patient impacts that we're seeing from these ransomware attacks. So when we talk about ransomware in healthcare, make sure we're actually talking about the impact that these attacks have on healthcare systems. Because if we're working to get budget, if we're working to educate people, if we're working to make sure that we're protecting ourselves better in hospitals and clinics and other areas of care, we need to make sure that they understand the risk. They don't really care about oil and gas pipelines. They care about emergency rooms at doctors' offices. So that's the first thing we can do. Start talking about ransomware in healthcare. The second, we need to better understand and address the shortfalls of Inplace IT. Effectively, most healthcare systems, most hospitals, have IT that is focused on a very specific 15 to 20 year span of protection, give or take 2005 to present day. The challenge that introduces is that there's a lot of technology that falls outside that span within healthcare. As a rule of thumb, we're seeing that about 2.5% of IT budgets are total budgets, are spent on IT, and about 5% of that is spent on cybersecurity. That means roughly 1/8 of 1% of hospital budgets are spent to better secure their environments. Now, I'm not saying that's high or low. I just don't know, and I don't think there's an accepted rate. If anyone has an accepted rate or a rule of thumb that they'd like others to know, please put it in the Q&A, and I'll be more than glad to share that. But as a baseline going forward, as a kind of thumb in the air, how much should we be spending? These are some rough guidelines that may be helpful in determining that and starting conversations going forward. Unfortunately, when we look at that spend, it's often leaving out big areas. The focus areas of that spend is typically on that traditional range of technology. Firewalls, phishing protection, awareness training, Windows security and patching, that core set of technology that hospitals have been protecting for 2 decades now. Unfortunately, that leaves massive, massive soft spots. Every engagement we go on, we see what we call medieval malware. Malware from the late 90s to early 2000s that's just bouncing around old machines. It's scary the number of Windows 98 or Windows XP machines that still exist in healthcare environments that the current IT systems just weren't designed to address because those attacks are so old, they never even considered them. On the other side of the house, we have the more modern technologies, IoT, IOMT, and OT devices, those connected devices that are running facilities, providing patient care. IT protections rarely cover those in any significant way. Same with APIs. As more and more systems are exposed to the outside world through APIs, data security and access security through APIs is incredibly lacking. And what that's leading to is evolving attack patterns amongst attackers. Effectively, ransomware collectives are going and seeing that these more modern devices, as well as this old malware that's bouncing around, are much easier entry points into healthcare systems, and therefore they're taking advantage of that. And so what we can actually learn from these shifting attack patterns is where we can best get the best security for spend. Again, this is from that Ponymon study that I referenced earlier. But when asked what was the root cause of a ransomware attack in your environment, the top answers were things you'd kind of expect: cloud applications, phishing, on-prem applications, et cetera. But what really surprised people is that IoT and medical devices made up for about 21% of the root causes of attacks. Same as phishing. And so when you look at your spend and your efforts around securing environments, ask yourself, am I putting the same effort, the same resources, the same spend into phishing as I am into IoT or medical devices? Am I protecting APIs at roughly the same rate as I'm protecting other systems? And the reality is that's probably not happening. So if you're looking for the most effective way to spend time and effort right now to get a large swath of devices and endpoints protected, IoT and medical devices are really, really the place to look at. And to better inform us on how attackers are attacking those, we have to remember they are running a business. There was an article that came out last week, I believe it was a profile on the Conti ransomware gang. They literally have an HR department, they have advertising budgets, they hire people through recruiters, they have employees of the months for people that get bigger ransoms paid out, et cetera. And again, going back to this article from earlier, it all is about financial motivation. How much money can they make? So we have to realize that ransomware attackers are running businesses. They're going after the lowest hanging fruit. And in many, many cases, the lowest hanging fruit are now things like the IoT devices connected to patients as well as hospital systems. And so that brings us to a question that a lot of our frustrated customers and prospects ask a lot is, how can I protect myself against all these things? And unfortunately, I don't have an answer for you today. This slide is intentionally messy. This slide is for you to take a picture and say, hey, we need to start addressing all of these levels. Who can we start with? Ultimately, what I'm going to urge you to do here is talk to your technology partners you already have in place and say, what are our protections for cloud applications, phishing, IoT, et cetera, et cetera? How do we build out a full set of protections around these to make sure that we're not getting breached from these most common areas of attack? So if you have others that you'd like to see in there, please pass them along. But I'm hoping this is a good start for people that are beginning on their ransomware protection journey and need to know who to reach out to. And of course, if you have any questions, reach out to me, reach out to our scenario team, and we will gladly pass along recommendations for the bigger swath of products and services to look at. So to wrap up this section, when we think about IT and we think about how to address ransomware, start asking your internal team. When we're investigating IoT and API security practices, how is our current IT systems actually protecting them, and where are our gaps that we need to add additional protection on. Because I think what you'll find is a lot of IT team members kind of hope that the IT systems in place protect against attacks on these devices, but in reality, they don't. And then when you're working with partners and vendors, push them, nudge them, tell them you don't want to be cybersecurity experts. That's why you hire them. Ask them if they have ransomware protection bundles. Ask them if they have complementary products that are going to protect every layer of the stack to better secure your environment. If they don't have one right now, they can probably very easily find a way to bring the right products together with a little bit of urging to help protect you more broadly against ransomware. All right, number 3. Let's better understand the unique dynamics of healthcare environments and staff supplementation. Now, to be crystal clear, I don't mean staff supplementation in terms of consultants coming in and slashing headcount. It's just the opposite of that. Staffing is incredibly challenging for everyone in healthcare. I think we all know that right now. If there is a way to make your team more efficient, give them the tools that, that they need, or give them additional resources to work with in some kind of creative way, you're going to see significant improvements in your cybersecurity posture. To do so, we have to actually understand what makes healthcare so vulnerable first from an industry perspective. The first thing that we have to understand is that healthcare is an industry unlike any other. Healthcare works to provide care first, and everything else comes second. And that's not a criticism. That's exactly what we want healthcare to do. Ideally, we would spend $0 on cybersecurity and healthcare, and everything would go to patient care. Unfortunately, we just don't live in that world. So we need to understand that when care is the priority, the spend is going to favor the patient. But what that leads to is challenges in actually addressing the issues that pop up. It's additionally complicated by regulatory requirements. Because hospitals are, because hospitals are compelled to report attacks, because the shame aspect from things like the HHS wall of shame exist, we're starting to see that regulations can be a bit more challenging and can also inform attackers more than we ever originally thought. It's not unusual for attackers to go to the wall of shame, see who's been breached recently, look at what type of breach it's been, and maybe kind of put them on their calendar for 6 months down the road to retest that kind of attack to see if the vulnerabilities are still there. So while that wall of shame was intended with really good reasons, letting people know if their providers have been breached, it has led to additional information being provided to attackers, which has hurt the industry a little bit as well. All of this comes together to result in technical results that lead to slower security adoption. The way I like to put this is if you put someone from Goldman Sachs Security next to a healthcare system CISO, they're going to be about 15 years apart in terms of approaches for securing their environments. Simply because Goldman Sachs, has motivation to protect their dollars, whereas healthcare has motivation to protect their patients, and that leads to different actions in different ways to value what you're doing within your organization. So this slower security adoption results in a greater attack surface, more weak links for attackers to focus on, and more ways for them to get in. And one thing we've seen over the last few years is the reliance on cybersecurity insurance has really started to bite a bunch of different hospitals, right? They thought cybersecurity insurance would be there, they'd pay out if there was an attack, they'd quickly recover, et cetera. In reality, we're seeing the payouts getting smaller and smaller. We're seeing the coverage of that insurance getting covering fewer and fewer things. We often see that the application process is more of an audit than anything. And if you decide to work with a cybersecurity insurance company in the times of a breach, in some cases, they can come in and take over entire operations of your healthcare system. Now, that's not to say that cybersecurity insurance is an awful thing, but it's not the dream scenario of, hey, we'll get a payout if there's a breach that maybe it was promoted as 3 or 4 years ago. So make sure that when you're going through looking at your policy, you better understand the policy and the full implications of the policy if there is a breach. And finally, with all these complexities in place, when a breach happens, you're ultimately going to receive conflicting guidance. The FBI and other authorities are going to say, don't pay ransoms, right? We don't want to encourage this behavior. We also don't want to fund additional attacks in the future. But if you decide not to pay the ransom, you'll find the recovery costs are often 30 to 50 times higher than the original ransom that was demanded. And that can lead to some really, really challenging decisions and discussions where there is no clear answer. There is no guarantee that if you pay the ransom, your system will be covered, or if you pay for the full recovery, that you won't be attacked again. So it's a really, really challenging situation because there is no silver bullet. There is no guaranteed way to protect against the attacks. Even more challenging, not only is the industry vulnerable, but the footprint that has grown within the industry is really vulnerable as well. We know that in the US, there are about 5 million operational devices that have critical vulnerabilities. These are devices that are attached, inserted, caring for patients in one way or another that have known ways to breach them if attackers get access to them. It's incredibly scary. That's about 5 devices per bed on average with a critical vulnerability. We also know that those devices are processing data that is incredibly valuable. PHI data has increased from 3 times the value of credit card information to 20 times the value in the last year. And the reason is pretty simple. If you steal credit card information and sell it on the black market, you can use it for a few days before the credit card gets shut off, and that information is then useless. If you steal PHI information, it has a significant amount of static data that is unlikely to change. It has names, birth dates, potentially social security numbers, addresses, parent information, sibling information, all that information for them as well. So one PHI record is going to hold a lot of data that is great for committing fraud, meaning the value has gone through the roof. On average, we're seeing those sell for about $250 to $500 per record in the black market. So you have all these vulnerable devices that have access to all this really, really valuable data. And that data is bouncing around in hospitals where about 75% of hospitals don't monitor traffic in any meaningful way. Again, it takes all the challenges of the healthcare industry that we're seeing and in practice makes them very, very target-rich environments because of this. And to add complexity to this, and I know all of you know this, but it's worth repeating, we're seeing a shortage in healthcare, not in just nursing and doctors and other caregivers, but the IT shortage is becoming more and more well-known as well. In short, healthcare IT workers are starting to realize that there's a lot of other opportunities, particularly remote opportunities, that may be less stressful and pay more. So as we see more and more of IT staffing shortage, there's going to be more and more need to figure out how to better secure environments when there's less talent to do it with. And so to do so, what I'd recommend is start taking a look at 3 different areas in terms of how you can better supplement your team. One, if you're focusing on a large effort, whether it's a large-scale security rollout, whether it's getting more biomeds in to actually monitor and maintain the devices, whatever it may be, start looking at more MSPs, managed service providers, or MSSPs, managed security service providers. What you'll find is that many, many partners can often come in, provide the service, the expertise, the technical know-how that you need to run your hospital and may not be able to find yourself. Even better, they'll provide the flexibility that finding full-time employees may not be able to. So as you're looking at your bigger projects, look at MSPs and MSSPs to supplement the staff that you can't find. Next, as you're working with vendors, those vendors, including us, are incredibly focused on making sure that you're happy with our product and that you continue to use our product. So push your vendors for things like TAMs or CSMs, technical account managers or customer success managers. These are people employed by the TAMs to make sure that the initial and ongoing adoption and use of your products that you're paying a lot of money for is successful. So you can often get quite a bit of really, really good work out of them as part of your subscription and service fees. So make sure to take full advantage of that and push them to the full extent of what they're able to do. And then on an individual cases, start being a little more creative in your thought. Look at part-time workers, look at people that may come in 1 day a week, look at contractors who might have contracts with hospitals throughout your region, or maybe even remote workers in some cases. The example I like to use here is I was talking to someone at a biomed conference, and it was the best version of creating thinking I've seen between a biomed contractor and the hospitals he serviced. Effectively, he lived in Western Texas, and every day, Monday he would drive 100 miles to his first hospital. Tuesday he'd drive 80. Wednesday he'd drive 120 the next one. And he hit 5 different hospitals every single week, and at the end of the week, he just dropped off his rental car, flew back home, and repeated it week after week. It was a great way to address the challenges of a bunch of rural hospitals who couldn't find highly skilled biomed folks in their region, combined with someone who didn't mind a little bit of travel to help these hospitals better hit their staffing needs. So start to see how you can better staff your teams with creative thinking like that. I'll share one other anecdote that we've seen here. We talked to one CISO who actually knows he will not be able to find skilled technical folks in his backyard. So what he does is he'll hit the local grocery store and he'll hit the local casino, ask the floor managers who the sharpest people that they've hired in the last 6 months are, and typically those sharp people just need an opportunity to learn and to grow. He'll then hire those people, train them up over 6 months or so, know that they're going to leave in 3 years, but also get 3 really good years of work out of them. I'm not saying that you should go and build an entire pipeline around casino workers that just need an opportunity. But I am saying with a little bit of training and a little bit of creative thinking, you may be able to fill some of the holes that you haven't been able to otherwise. Next, let's talk about making security achievable. One of the good things about healthcare environment is that very rarely, particularly in hospitals, is there economic competition. Sometimes there are for elective surgeries and things like that. But more often than not, hospitals are focused on care first across the board. And that gives us an opportunity to actually learn from communication styles of other industries. Specifically, look at what happened when Bayer was breached 5 or so years ago. Instead of holding back all the information, they went on a roadshow where they explained to other pharmaceutical companies how to better protect their environments. Now, there were some regulatory pressures that led to that. They got off on about $150 million of fines they were let off from because they shared their experience. But we can learn from this. We know that if you start working with people in your region, start working with your peers to understand what they're doing, what attacks they're seeing, how they're handling those attacks, you can implement those same protections in your environment. And I'll talk about a couple of groups that do this in just a second. But ultimately, find a way to better connect with your peers, share the experiences and stories that you've had when it comes to ransomware attacks, and put those in place. Next, enhance your teams. I talked about MSPs and MSSPs to reduce your IT staffing challenges, but also look at things like what happens when you are attacked, because it's probably going to happen at some point. It's just hopefully further down the road than tomorrow. So start looking at things like hospitals in a box, things that you can stand up very quickly, networks that you can throw together, you can plug monitors into, you can plug a nursing station into, so that the very basic needs for technology are met. If you have a plan to respond quickly in a time of panic, much like when you would set up triage booths in a gymnasium or something, it can be really, really good in terms of planning and then execution when the worst case happens. So consider hospitals in a boxes, consider who you're going to call when an attack actually happens, things like that. And then take advantage of the shift to remote work. The majority of our customers we work with go into the hospital maybe 1 day a week on average. Many are fully remote. So understand that there are more people, both within the States and potentially worldwide, that can do the technical work you need to. You're still going to need some folks on the ground, but for the most part, a lot of this work can be done remotely too, which opens up a lot more hiring opportunities for your team, and in some cases, cost savings. And then finally, try to investigate emerging best practices as best you can. Now, it's unlikely you're going to become a cybersecurity expert or the cybersecurity expert, but you can become more and more knowledgeable based on emerging security practices. The first thing we like to talk about is inventory is not security, right? Just because you see all the devices doesn't mean that you can properly secure the devices. So when you're looking at different vendors, different offerings, make sure you understand not only how they identify everything in your environment, but also how they put actionable steps in place to make sure that you can secure the devices and the related vulnerabilities when they are identified. More importantly, make sure they can give you a prioritized list of what needs to happen first, second, third, et cetera, so that you're not trying to solve a million problems at once, that you can solve the top 3 issues today, the top 1,000 over the next 2 months, et cetera, et cetera. Next, make sure you're aware of industry alerts and attack patterns. Specifically, join working groups, which are intended to provide an area for healthcare workers and administrators to work together. My preferred group is Cyber Health Working Group. They work in conjunction with the FBI. They're at www.intelligence.healthcare. There are others like the InfraGard group and a bunch of others out there. So find groups where you can go and you can ask questions, where you can share your experience. You'll find very often that people are not only open, but will give you very clear guidance, very direct guidance about vendors, experiences, et cetera, with a really, really quick turnaround time. And then finally, ask your vendors, ask your providers, ask your MSPs, how can they help increase your team efficiency? Push them, particularly vendors that are rolling out products in your environment, push them to provide additional services, additional team members to supplement your team. Your team should not have to be experts on every single piece of cybersecurity technology. They should be capable and have experts they can rely on. And vendors' teams can often help with that. You also want to encourage action today. So start having focused discussions with your teams. Specifically ask them, and this is a bit self-serving, but specifically ask your IT, network, security, and biomed teams, how are they addressing IoT security? I think you'll find that some of them assume IT systems will just protect against all those thousands of IoT devices they have in their environment. Usually that's not the case. So start to figure out what are the gaps between IT systems and IoT security practices that need to be filled, and if there are compliance requirements that need action. Overseas, England in particular is starting to require IoT-specific actions. We're also starting to see bills passed, like the patch bill is being considered in Congress right now, which would require certain actions around IoT security. So start to investigate this now so you don't magically find that laws have been passed that are forcing you to do X and Y and Z. Next, start to actually role play and plan your response actions. In the event of a ransomware attack, who are you going to call? More specifically, if your email, your phone, if everything is taken offline and you don't have access to your phone book, do you have on your sheet of paper in your desk that's going to tell you, hey, I need to call Bob or Susan or whoever at this company to help with response actions? Don't rely on technology in a time of cyber attack because it may magically disappear overnight. When you're going through those exercises, start to figure out what immediate actions are you going to take. Are you going to go around and start unplugging all the machines that are connected? Are you going to completely cut off everything from the internet? Understand the actual actions you'll take in the moment so you're not making them up on the fly during a time of attack. Understand from a financial aspect what amount of downtime and recovery costs you can reasonably handle. Going back to that University of Vermont medical system podcast I was talking about, they had roughly a month of downtime where they had to work to restore the entire hospital system. Some healthcare networks won't be able to financially live through that. So make sure you understand what the real existential threat to your system is beyond just, hey, we have downtime and people are having compromised care. And then finally, do dive deep into your cybersecurity coverage. I think you'll find that it probably doesn't cover nearly as much as you hope it would. And you may want to start planning for alternative options or ways to supplement that. And then finally, you can always contact us. I'll have some more contact information as we go. I see a lot of questions coming in, but I'll make sure to answer any on email as well. So reach out if you have questions there. The final thing in this section I want to talk about is that we are starting to find new challenges within healthcare as we study more and more of the IoT devices. And we're starting to find that there's actually achievable solutions that may not be mainstream, but will actually start to reduce risk. This comes from our data report that we released back in January. We will have a new version of it coming out this summer. But we found that 53% of these connected devices in your environment, IoT and IoT devices, have at least one critical risk. Half of the devices in your environment that are providing patient care that are connected have a critical risk. Absolutely terrifying. But we're also seeing that 2/3 of those risks can be addressed by mitigation, and 92% of the critical risks can be addressed by segmentation, So even though we may not be able to patch all these devices, even though we may not be able to find a 100% fix, we can put network level policies in place that will protect a significant number of these devices to a level where it's unlikely that they are attacked. The added benefit there is if one does get attacked, it will limit the amount that attack can spread throughout your healthcare environment. So do know that as more and more research is being done on these more modern technologies, we're finding more and more ways to better secure them and secure them at scale. So it's not quite as daunting a task as we may have thought it was even 18 months ago. Number 5, in the final section, you can immediately identify and stop attacks. And this is one of the things that our scenario team does. What we're finding is there's 2 very specific avenues that customers want to go down in terms of protecting themselves from cyber attacks. The first goes along the lines of the traditional kind of triage and emergency response mindset, where there's an immediate threat, there's an immediate issue that you want to take care of, you want to do it in the most efficient way possible, and you want all the noise out of the way. And so what we've done is we've created a technology called attack detection and response, which effectively goes into your environment and in a couple days identifies any active attacks that exist. It may seem counterintuitive, but attackers don't often pull the trigger on these attacks immediately. They can sit in your environment for up to 9 months before fully executing, because a lot of times what they're doing is they're sitting there, they're exfiltrating data so they can sell it on the black market, they're finding other vulnerabilities they can attack after you've recovered from a breach. So we go in and we find those active attacks that other systems have missed, particularly in-place IT systems. And then we roll out a longer-term care and recovery strategy for securing your broader environment. We start with critical IoT risk reduction. We then segment your networks. And I'll be glad to go into segmentation on another kind of more technical discussion with anyone that wants that. And then we move to a more business as usual model of IoT risk identification mitigation. So effectively what you can start doing is identify the attacks today and stop those attacks. We find those in about 80% of environments we go to. They're typically pretty straightforward to address once we identify them. And then we go to a longer term risk mitigation strategy from there. And if that is something that interests you, you can start with ADR today. We can literally have a box if you're near a major shipping hub to you tomorrow. What we have is our active attack detection offering, which has a 5-day runtime. There's no cost, no commitment. We find malware in 80% of engagements, and critical risks are detected in 100% of those engagements. So do know when you're ready to start, we are here to make sure that there are no active attacks and then figure out a longer-term plan to address those. Now that my pitch is out of the way, let me give you some additional resources, and then we will go to questions, because I see a whole lot of questions have come in, which is great. First, some additional resources that I mentioned as we went through. Jekylbot 5, again, we will have another webinar later this week, but we do have an entire command center around that. So if you want to learn about the vulnerabilities in those Athon Tug devices, if you want to, if you want to learn more about the specific attack vectors, we go into that as well. We have videos, papers, etc. So if you just want to see what a cyber physical attack looks like in terms of identifying it and attacking it, in a safe way, of course, there's a lot of resources there. Additionally, we did a data analysis and report on our entire pool of data, ranging millions of devices over a few hundred hospitals. So if you want to see the results of that analysis, that was released back in January, and our data report is available in the top right. We try to keep it concise. It's 16 or 17 pages, give or take, lots of really good graphs, lots of very specific reporting. So if you want to understand the security posture of IoT devices in healthcare environments, this is 100% healthcare focused, that data report is a really, really good resource to read. It's maybe a 20 or 30 minute read. It goes quick and it's very informative. We do have our ADR offering that I mentioned prior, and we do have the Jekylbot 5 command center. So if you have any other questions about those, go ahead and let me know. And I will go ahead and pass it back to Katie and Perla for questions.
Thank you so much, Chad, for that great presentation. We're now going to begin today's question and answer session. So this is a reminder to submit any questions you have by typing them into the Q&A chat box on your webinar console. I think with that, we're going to get started with the first question. And this audience member is asking, how do you see technologies like Darktrace that utilize AI fitting into this cybersecurity ecosystem?
Yeah, so Darktrace, anything using AI, ML, is incredibly valuable, but there's always a human component there, right? AI and ML is really good with really, really large data sets, but often does need tailoring. So as long as they are properly tailored, they're properly trained, and they're properly constrained, they can be beneficial, but they're not the magic bullet. You're going to always have to balance technology with humans to make sure that technology is effective. The other thing you want to consider, we want to make sure that active testing is not being done to devices that are actively providing care. Most modern technology has some way to either flag those or to avoid effectively attacking devices in care. But it's one thing you absolutely have to check on, that when you're doing some kind of analysis, that it's not going to do anything to devices providing care that would compromise that care.
Thank you. This next question says, would Scenario be providing more targeted security and monitoring aside from what other companies like Amazon Web Services and IBM are offering with their products?
Yeah, absolutely. So it really goes to what level of security are you looking at? So if you look at something like Amazon offers, and by the way, we're Amazon partners, we work with Amazon quite a bit. Most of their offerings are at the cloud level. So they may not see attacks that are happening within an environment. If malware somehow gets in off a thumb drive, say, and is spreading throughout the environment, but does not phone home, it does not try for some outbound connection in that moment, it's incredibly unlikely that cloud offerings like that are going to see that. They may see DDoS attacks that are actively being attempted, but they won't see things on the network environment. So what we do is we work with them for kind of a hybrid deployment where we have a collector that sits in our customers' environments and it looks at network traffic, or excuse me, it looks at a copy of network traffic. So it doesn't actually interfere with your network in any way. And then it identifies malicious activity to make sure that if there is activity that those cloud providers just don't have insight to, we can start to address it in the moment. We also then take a subset of that data, about 1% of that data that has all sensitive patient information stripped. So think of it in terms of device manufacturers, device serial numbers, et cetera. We then process that in the Amazon cloud so we can do further analysis. So with healthcare environments, this is a really good model because we get the power of cloud services like Amazon or Microsoft combined with the on-prem power of analyzing active attacks that may not make it to those clouds. I think that answered that question, but feel free to ask a follow-up if needed.
Thanks, Chad. This next one says, do you have an audit program or checklist that you can share so that providers can perform a self-assessment?
Ooh, that's a good question. I will have to check with our team to see if we have something off that we've distributed to customers. I don't know that. I do know that there are recommendations out there, but I don't know if one off the top of my head. So follow up with me offline, and I'll make sure to get you that resource. I just don't know where it exists.
Great, thank you. So this next question says, what do you think of the various forms of legislation that are being proposed in the U.S. that focus on securing healthcare environments? For example, there's the Patch Act that would put baseline requirements in place for medical and non-medical IoT devices. What do you think of some of those proposed legislations?
Yeah, so this is a really timely question. The Patch Act is getting a lot of coverage right now. I was actually at a conference in DC last week, the CyberMed conference. It was awesome. CISA participated, the FDA participated. It was really, really good. And this was discussed quite a bit. And kind of the consensus in the room was, it's great that legislators are starting to look at some kind of legislation around requiring security. But the reality is, if there's not the right amount of teeth in there and the right amount of funding, it's really just passing a law for law's sake. It may not actually have the intended effects. And the example that was used over and over was what happens to small and rural hospitals that may have really, really tight budgets that now have all these additional requirements on top of them and just don't have the budget to do so. You know, there's kind of a catch-22. We want them to be secure, but we also need to fund additional security practices. So back to the original question, I think it shows movement in the right direction. There's raising awareness that we need to secure these devices. Better guidance needs to be available, but better funding also needs to be available. And I think that's going to be a combination of not only the government, but also the healthcare industry working together to figure out how to best approach that. The best example I've seen of this in other industries is what the credit card industry did with PCI DSS. Effectively, they said years ago now, we are going to face legislation if we don't do something to curb credit card fraud. And they came together and they formed a group of standards that the entire industry now kind of goes by. So I would really like to see the healthcare industry lead the way, guide lawmakers, but make sure that they're self-regulating as well. One more really interesting point that some of the doctors, ER chiefs, brought up during that discussion was that, excuse me, was that unless there is a major event that causes the funding or the legislation to be passed, it's just something that's going to be talked about. And they named two specific major events. One is the healthcare industry bands together and lobbies for changes. That's the positive way we could address this. The other is some kind of catastrophic event that leads to front page news. I'll just leave it at that. So hopefully the healthcare industry can work to self-regulate this, because it will better inform laws that will eventually be passed.
Thanks so much for providing some context to better understand some of those legislations that are being introduced. Our next audience question is, how realistic is it for small and rural hospitals to adopt and support the new technologies you mentioned, given traditionally tight budgets and traditionally tight staffing shortages?
Yeah, so small and rural hospitals are roughly 70% of the healthcare environment in the United States. What I think you'll find, a lot of vendors, including us, have small and rural healthcare packages, both in terms of the technology and the people to help support that technology. So if you have the challenge of finding really skilled technologists locally, you can sometimes find those with your vendors. The other thing I would recommend is that vendors absolutely love case studies and absolutely love working in creative ways to make sure their technology is being put in a good light. So if you are trying to deploy to a small rural hospital, budgets are tight, offer up a case study, offer to speak with customers, offer to speak publicly, offer to speak at local private groups. And what I think you'll find is that vendors are a bit more willing to negotiate on price if they can get promotional opportunities out of it.
Thank you. Those are some great recommendations. This next audience question says, every dollar spent on IT or security is a dollar not spent on patient care. At what point do we freeze IT budgets and just accept the risks of new technology?
Yeah, I've seen people try to do that calculation. The rough numbers are about 10% of hospitals in the US got hit by some kind of cyber attack last year. And so what people do is say, well, I have a 1 in 10 chance of getting hit. Am I going to spend more in ransom payments or recovery costs than I would over 10 years of just avoiding things? The reality is there are growing best practices that you can put in place, and the prices for those best practices are getting smaller and smaller. So if you're not willing to go down that road right now, you should at least be investigating it, because the discussion gets much, much tougher if you've done nothing to address these and you do get attacked.
Thanks so much, Chad. We have a new audience question that says, how can we convince execs that more manpower is needed when companies that do manpower studies always come in and say that IT is overstaffed?
I would say get creative in your discussion. Don't focus on full-time employees, and don't focus on a team of consultants that come in and sit next to your employees for 40 hours a week forever. Start talking about what you actually need to achieve and how you can achieve that. So the biomed use case I used earlier, where that biomed hit one different, the biomedical engineer hit one different hospital in Texas each day for a week, they only had a 20% of an employee there, but it was much cheaper for the hospital to pay for, and they got the same expertise they needed. So I would change the discussion from, we need this number of headcount full-time, to these are the specific actions we need, here's how we can staff them, and here's the added benefit of them providing additional resources through an on-call model in a time of need, if you're attacked, for example. So change the discussion from full-time employees to actually addressing the issues that need to be addressed.
Thanks for those recommendations. It looks like we have time for about one more audience question. I'll ask this one that says, it's agreed that healthcare is a unique environment for security priorities. However, can't we also learn from security architectures of longer established security technologies like industries such as aerospace or energy? Is it an either or can we learn from these other industries?
Oh, sorry, I stepped into there, Kay. I apologize. No, you can absolutely learn from other industries. And I used the Goldman Sachs example earlier. I would love if every hospital CIO or CISO sat down with a CTO or CISO from a major finance company or insurance company, because they're just so far ahead in their security practices that there's a lot of information that could be shared. You do have to take some special considerations in terms of patient data and things like that. But no, if you can find a way to discuss the security practices of more mature industries and how they would apply to your field, it's absolutely the right path. The other thing I'll say there is a lot of vendors actually use the same models over and over and then tailor them specific to the industries that they're working with at the time. There can be some data loss there if you're not entirely healthcare focused, but the overall deployment model and architecture remains pretty much the same. It's a good question.
Thanks so much. I think that's all the time we have for today, and I want to thank you again, Chad, for an excellent presentation and for Scenario for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you again for joining us today, and we hope you have a wonderful afternoon.
Thank you, everyone.